Hello, everyone, and welcome to the CLRC professional panel event. And I'm actually going to share my screen. And before we get started with our feature presentation, I'll just make a brief introduction about the CLRC and about the professional panel, and we'll give plenty of time for people to join. All right, hopefully you can see my screen as well as my PowerPoint screen, as well as me as well. So first of all, I want to thank our speaker, Carrie Schwartz, who is actually one of our professional panel members. So this is actually a perfect opportunity to bring up that if you are a professional panel member and would like to lead a free CLE presentation, it's a great way to get your name out there, to build experience presenting. And I also do believe that when one is teaching others, they learn their topic even more. So it's a win-win all around, and other professional panel members, people from all sorts of different specialties will get to know a little bit more about your practice. So please write any questions that you have for Carrie or any other questions in the chat. Hopefully we'll be able to upload some of the supplementary materials in the chat as well. So again, feel free to write any questions or comments in the chat. This presentation is recorded, but the attendees will not be recorded. After the presentation, we will be following up with information and the certificate of attendance so that eligible attorneys will receive California MCLE credit. So again, I'd like to thank Carrie Schwartz and Julie Fisher from Kantor and Kantor, Emily Mouse and Emily Artner from the CLRC and DRLC, who have been and are making sure things today go as smoothly as possible. So first of all, some of you may be very familiar, but others may not know what the CLRC stands for. The CLRC stands for the Cancer Legal Resource Center. We are a program of the Disability Rights Legal Center. The CLRC provides information and resources to people affected by cancer, including patients, survivors, caregivers, and health professionals. Our resources are free, no matter what, regardless of income. People often ask, what does cancer have to do with the law? This is a list of some cancer-related legal issues. Cancer affects the patient, survivor, families, healthcare professionals. It impacts many different areas of the law. If someone is affected by cancer and has a legal question, whether or not the topic is listed here, they can contact the CLRC. Now, I see that there's a few things in the chat. You might be seeing this, but I just wanted to make sure that I pulled up and made sure that everything in the chat is related to the materials and not any specific questions for me. So this screen is important because as a professional panel member, you might be thinking, or prospective professional panel member, you might be thinking, oh, does my specialty provide any help for the CLRC and potential callers? Well, as you can see, there's a really wide breadth of potential topics. So one more thing before we talk a little bit more about the professional panel itself is that the CLRC makes sure to do community outreach in a socially distanced way and do webinars. The series is called Empower Hour. Anyone, attorney or otherwise, can check out these webinars. They're supported by a generous grant of the Tower Cancer Research Foundation and a generous grant from CGen. We had our first webinar last week. You can access it online. Our next webinar is May 5th about housing rights, noon Pacific. Each webinar is its own contained topic. So it's a great way to become informed about what issues matter to people affected by cancer. And all of it is helpful. I'm leading them. So if you like this and want to spend more time together, it's a great way to learn and keep basically informed on some really cutting edge issues. All right, so our professional panel. Most of the people here today are either current or prospective professional panel members. On behalf of the entire CLRC, we wish to thank our members of the professional panel and to thank anyone in attendance. If you're not a member of the professional panel and after this presentation, you still don't want to join, it's okay too. our goal is to really educate you about what Carrie's speaking about, and also to inform you about the CLRC and the professional panel. So there's no pressure at all. We just want to make sure that you enjoy. As a member of the professional panel, it's an extraordinary opportunity to help someone affected by cancer. We provide vital legal resources, and one of the single most important resources we provide is the contact information for a licensed attorney in that person's state that practices in the area where the person needs help. So quite frankly, that's what we hear from callers. We don't know if they'll ever follow up with you, but we do hear when we call them back and provide the information for a licensed attorney, that is crucial and can make them feel really good about the help that they are getting. It's a minimal commitment because the professional panel member only agrees to 30 minutes for free for the person that contacts them. I did put the website on your screen to apply. It's a free application, and you can always apply and see what happens. Another important point is to stay in touch. Please keep your information updated, whether you've taken on an additional practice area or even if you're practicing an additional state. During the pandemic, some people may have changed their offices, or changed their contact information. So please feel free to keep us in the loop. We want to make sure that if someone wants to reach you, that they can. Many people who contact the CLRC have more than one legal issue. So a person might be facing a landlord-tenant issue, but if you're practicing employment law and now handle health insurance matters as well, there may be another way you can help. So also please get the word out to any friends or any bar associations or any place that you're involved. We do appreciate people getting involved. So without further ado, hopefully now this brings us all on the same page. And for those who have been familiar, it's just a really brief refresher course. Carrie Schwartz, she's our featured speaker and a lawyer and a partner at Kantor and Kantor LLP, a contingency law firm specializing in obtaining health benefits. Carrie submits appeals and litigates cases across the country to recover health benefits for her clients' health treatment. Her cases involve a wide variety of illnesses such as breast cancer, prostate cancer, eating disorders, mental health disorders, and substance use disorders. Prior to joining Kantor and Kantor, Carrie practiced SSDI, that's Social Security Disability Insurance Law, for more than 10 years and enjoyed the unique challenges of navigating Social Security Administration's disability system and getting her clients paid the benefits they deserved. Carrie is consistently motivated to advocate for her clients. We are thrilled to welcome Carrie. I got a glimpse of her presentation. It's really interesting. So I'm so excited to hear the whole thing and to also learn a lot. Some of this stuff might seem intimidating, but Carrie's going to break it down for us, which I think is fantastic. So I'm thrilled to welcome Carrie, and I've now concluded sharing my screen. Hopefully, Carrie, you'll be able to do so as well. And again, we're so grateful that you're speaking to us today. Thank you.
Thank you so much, Shelley, for that amazing introduction and for having us here today. Thank you to everyone at CLRC for putting this together and working so diligently so that we could make this happen. I want to just first and foremost, again, welcome everyone. Thank you for taking time out of your busy schedules to attend and join us during your lunch hour, or maybe not your lunch hour because you might be working otherwise. We wanted to put together a webinar that would help educate people in the legal community about health insurance policies and provide some practical tips and advice for getting health insurance benefits paid for patients who are undergoing cancer treatment. And actually, in a broader sense, this would really apply to people who are undergoing any type of treatment for any health-related issue. We're going to touch upon issues such as plan terms, explanations of benefits, submitting appeals. There's a lot of really great information. I will do my best to get through all the information in the time that we have here today. I will try my best as well to reserve some time at the end for questions, but if we are unable to get to your questions today, please feel free to use the information that's been provided in the chat and will be provided again at the end of the presentation to reach out to me, whether it's a general question or a specific question, maybe an issue that someone's brought to your attention that you'd like to explore a little further. I'd be more than happy to discuss any issues and try to provide any guidance or insight. So I am a partner at Kantor and Kantor. We are based in Northridge, California. We also have offices in the Bay Area, in Nevada, Oregon, Washington State. We have approximately 21 different attorneys, and we are a contingency law firm. All of our work is plaintiffs, and we really consider ourselves an employee benefits firm. So we work on a range of issues from health related benefits to life insurance benefits, disability benefits, pension benefits. We work on appeals and litigation nationwide, and we have different focus groups with different attorneys that really specialize and really understand the issues that are involved in each individual case that we take on. We also happen to be the only law firm in the nation that has a focus on mental illness and eating disorders, which is something that we're really proud of. We're proud of the work we do in that area. We're proud of the accomplishments that have been made in that area, considering all the stigma and lack of access to treatment for people with mental illnesses and eating disorders. We represent patients and their families in administrative appeals and litigation when health claims are denied. And again, health claims is a very broad net, but we do work with a lot of people who are undergoing treatment for various types of cancer. My contact information is here for those of you who wish to refer back to it later on. The presentation will be provided to you after the presentation is concluded, whether you receive an email today or tomorrow, but you will receive a copy of the PowerPoint. So I just wanted to point that out, so you don't have to take lots of copious notes. So it's always an interesting maze, source of confusion. How do we get insurance claims paid? That seems to be the real big issue that confronts people when they contact us. And it feels like there's no end in sight. And people often come to us at a very difficult time in their lives when they or their loved ones are undergoing treatment or have finished treatment and they're starting to receive denial letters or bills. So how can we help people? How can we help people make sure that claims get paid when they're undergoing treatment for cancer? Here's our top 10 list of ways that we can try to help people who contact us. We're going to talk about types of health insurance, understanding and knowing key provisions in health plans and why that's important. We're going to talk about in-network and out-of-network benefits because there's a lot of misconceptions and misinformation. We're going to talk about submitting timely claims. We're going to examine a sample of an explanation of benefits, which is often referred to as an EOB. We're going to talk about and look at what a quality appeal looks like and why that's important, why communicating with the insurance company is important, what medical necessity guidelines are, and where do you find them? When do you ask for help? And we'll conclude by looking at a couple laws that are in effect that might help patients with cancer as they're navigating the medical system. So oftentimes people contact us and they say that they need help with a health insurance matter. And the first thing that we always need to figure out is, does this person have an ERISA plan or a non-ERISA plan? That's the starting point. So what is ERISA? It's a very good question. A lot of people use the acronym, throw the term around, and aren't necessarily familiar with what it means. So let's break it down first because it's a very good place to start with a base level of knowledge. ERISA is the Employee Retirement Income Security Act of 1974. ERISA initially applied to pension benefits, and it later developed into broad law governing all employer-provided benefits. So that encompassed disability benefits, life insurance benefits, and health insurance benefits. Federal regulations require plans to develop specific procedures for full and fair review and procedures as to when and how to respond to appeals, and written procedures as to how employees can sue the plan if they don't agree with a determination that was made. ERISA plans can be insured, which means the benefits are paid through the insurance policy, or an ERISA plan can be self-funded, which means benefits are paid through employer funds or a trust. That information has to be disclosed in the plan. Here are some quick facts about ERISA, what it does and doesn't do. So what ERISA doesn't do is it does not apply to government or religious employers. Those are exceptions to ERISA. ERISA does not allow for jury trials or state court litigation, and ERISA does not allow for extra contractual damages such as punitive damages, damages for emotional distress, damages for financial distress. But what ERISA does do is it does apply to all other employers regardless of size. It does allow employees to sue in federal court if the required appeals, usually there's up to 2, but sometimes it might only be 1. But as long as the appeals were done or what we might call exhausted, then employees will have a right to bring an action in federal court. ERISA does allow for damages in court, and that is limited to benefits that should have been paid, interest, attorney's fees, and costs. The goal of developing the ERISA regulations was to help employees. So how do the regulations help employees when they have a dispute? It is designed to include everything in writing. So an ERISA plan has to include written claim procedures. It has to include written information about denials and how those denials can be appealed. ERISA also regulations must provide that denials can be a letter or, and this is really important, an explanation of benefits. Oftentimes people don't realize or understand that an EOB denying services or treatment is the same as a denial letter. If an EOB denies treatment or services, then that is considered a denial for purposes of triggering any deadlines that have to be met. ERISA regulations provide that a plan cannot require more than 2 appeals, but can offer more. First appeals under ERISA plans cannot be due any sooner than 180 days from the denial or EOB. Or it could be later depending on the policy. So if the policy provides something that is not 180 days, then whatever is written in the policy is what we look to as the controlling deadline. Second appeals, as we said earlier, are not always required, but if a second appeal is offered, it can be due as short as 60 days. So knowing these appeal deadlines, again, is critical, because if a plan says that you have to exhaust your appeal deadlines and you miss a deadline, then it might preclude the ability to pursue litigation. Urgent expedited appeals must be decided within 72 hours. And these are appeals in which a person is in imminent risk of harm or danger if they don't receive the medical care or treatment that is being requested. Concurrent care requests must be decided before the approval period expires. Concurrent care requests generally apply to people who are in a type of treatment or facility for a set period of time, And a concurrent care request is a request to the insurance company that additional care, additional treatment, or additional days be extended or offered to the individual while they are in treatment. Not after they leave, but while they are still there. So there's a continuity of treatment or care. ERISA also provides requirements for denials. So again, how does this help employees? An ERISA denial for benefits must include in writing a specific reason for the denial. There must also be a description of any additional information that is needed to perfect the claim and an explanation of why such information is needed. So for example, oftentimes we see denial letters that indicate that additional treatment records are needed. Yesterday, I reviewed a denial in which it stated that a detailed invoice or billing statement from the provider was needed. So again, they have to tell you what is required, and it must be in writing. A denial letter also has to inform the person where the appeal is to be sent. It must provide medical necessity guidelines or offer to provide them free of charge. So oftentimes it's common for the denial letter to reference a medical necessity guideline that was used in reaching the decision. And then it will be followed by a statement such as, if you'd like to obtain a free copy of these medical necessity guidelines, you can write to us or call us, and then it provides that contact information. A denial letter also has to explain the medical necessity determination. So it's not enough for a denial letter to say the treatment was deemed not medically necessary. It has to explain what was not proven or what was missing to establish medical necessity of the requested treatment. Under ERISA, there's no deference to the original decision. A different person must decide the appeal, so it can't go to the same decision maker or the same medical reviewer who consulted on the first appeal. And ERISA requires that the insurance company consult with a healthcare professional who has appropriate training and experience, who was not consulted in connection with the denial. So again, it's really important that these guidelines are there to try and make sure that employees have a full and fair review of their health claims when they're submitted to the insurance company or the plan. So if you'll recall, when we started this conversation, I said there are ERISA plans and there are non-ERISA plans. So if an ERISA plan is something that's obtained from an employer, a non-ERISA plan could be one of the exclusions we talked about earlier, which is a government or religious employer benefit. So if someone works for a church group or a school district, these are often the biggest exceptions to ERISA. And an insurance policy that's purchased privately through an insurance agent or through an exchange, and the individual is paying or responsible for the entire premium. These are the biggest categories of non-ERISA plans. It is important that individuals request a copy of their plan from their insurance company or their employer. Oftentimes people call us, tell us that they have an ERISA plan or a non-ERISA plan, or they're not sure. And they start in with a question, and they're asking us to provide them with an answer or guidance or instruction. And we always tell people, we have to see the plan. We have to see what the language is that will instruct you as to what your rights are, what your deadlines are. So for non-ERISA plans, some of the key features are that there are jury trials, evidence that is not within the administrative record can be used, such as testimony from experts or witnesses. In a non-ERISA case, remedies can include benefits, emotional distress damages, attorney's fees, punitive damages, depending on the state law, and whether the employer plan was insured. And sometimes in non-ERISA plans, there's also an allegation of bad faith. So there might be bad faith remedies available depending, again, on state law. So we've talked about the two types of health plans, ERISA plans and non-ERISA plans. This is just a recap of how you get the plan, whether it's through an employer or whether it's an exception because it's a government or religious employer or an individual insurance policy. How to get the plan or policy. This is really important. People need to know that if it's an ERISA plan, they should get the plan from their HR department. If it's an individual plan, then they can ask the insurance company or possibly the employer. And in both circumstances or situations, I always tell people that they can always log in to their health insurance portal, and they should be able to access a copy of their plan there. And when we're talking about a plan, we're talking about a full document that could range anywhere from 50 pages to 100 or 125 pages, but not a summary plan description or a summary of benefits, because that will only provide possibly 4 or 5 pages of an overview of the benefits. But to really understand what an individual is entitled to, they have to have a copy of the full plan or the full policy. So some of this is just repeating the differences between jury trials, non-jury trials, the types of damages, the type of trial that you're allowed to have under the different types of health insurance plans. The next topic or tip is about knowing and understanding the key provisions for health benefits and really what you should be looking for or suggesting that someone look for when they're trying to understand what their plan provides, what it limits, and some things that are really important to find and locate in a plan. So I've just tried to provide a few that come up most often. One of them is pre-certification or a pre-authorization penalty. And this is often enforced by an insurance company when someone doesn't ask for pre-certification before seeking treatment, starting treatment, being admitted to a treatment facility. And depending on the language of the plan, it could be a dollar amount, such as $500, or the penalty could be the denial of the entire claim. So this is really important for people to know and understand, again, before starting treatment or before admitting to a facility, because this can be something that could ultimately bar payment of the claim. Another provision that we look for when we're analyzing a case or reviewing a matter that comes to us is whether there's a provision for proof of loss or deadlines to submit claims. Statute of limitations is another important term. What is the deadline to file a lawsuit? It might also tell you what needs to be done before filing a lawsuit. And I've mentioned this before. One example is whether all appeals have to be completed or exhausted before you can file a lawsuit. It's really important to know what the time frame is to make sure that you are adhering to that time frame and not missing any opportunities or deadlines to file anything. We also want people to look for and understand how many appeals they have provided in their plan and what that time frame is to submit those appeals. Again, a policy might provide up to 2 appeals plus an external review. One appeal deadline might be 180 days, but another appeal deadline, the second one, could be as short as 60 days. So this is really important that people focus on finding this information. We also look at medical necessity or medically necessary definitions. And these include language such as generally accepted standards of medical care. Every plan has to tell you what is their definition of medical necessity or how they define medically necessary. So the lesson here is if you do not have a copy of your plan, then you do not know what is covered. And the tip that I always tell people is ask for your policy or plan in writing and don't wait. You should get that the minute you are enrolled in a plan. You may be entitled to penalties in litigation if the plan or policy isn't provided to you upon request. So it's important to do this in writing. Document your communications with the insurance company. Make sure that you are dating and signing your communications and correspondence and that you're keeping these in a file so that if the case proceeds to litigation, you might be able to recover some penalties. So in-network providers and out-of-network providers, this is a really interesting and timely issue. Sometimes we call them in-network providers. Sometimes people use the term participating provider or non-participating provider or out-of-network provider. But what we want to take away from this discussion today is that reimbursement or payment is vastly different for each. So what are some of the common questions? Well, there's no in-network provider in the area or with specialization in the type of treatment that the individual needs. What do we recommend? We always recommend that people ask for a single case agreement or a gap exception for an out-of-network provider to be considered in-network. This also presumes that the provider is willing to agree to the insurance company's rate and is willing to bill the insurance company. It's really important that people have this conversation and make a decision as to whether or not they're going to ask for a single case agreement or gap exception prior to treatment. If you ask for this after treatment has commenced or after treatment has concluded, you will not have any chance. So please make sure that this is something that is done prior to treatment. Sometimes people say, well, there is a doctor available, but I would prefer to go to another doctor because I know him or her from someone else, or I like the location of his or her office compared to the other doctor. Unfortunately, that's not enough. You have to be able to show lack of availability within 50 miles of your home, or the provider has specialization that is not offered in your network. Sometimes we find that there is what's called network adequacy issues or ghost networks, where an insurance company might say, oh yes, we have plenty of in-network providers who are within 50 miles of your residence. But in fact, when the individuals go to contact those doctors from the insurance company, they find out that the doctor does not in fact have the specialization that's needed, or perhaps they're not taking new patients. So it's important that if you have this information from the insurance company, that you exhaust all of the doctors that they have provided to you and then go back to the insurance company and say, unfortunately, I was not able to find anyone on the list of providers that you offered to me who are able to provide the specialization I need, or who are within 50 miles, or who have availability to take on new patients. Network adequacy issues are a very big problem right now with insurance companies who are unable to maintain a sufficient list of in-network providers to meet the various specializations that people have and that people need for the treatment. An issue that comes up often with in-network providers and out-of-network providers is what's called balance billing. Some states have enacted laws that protect patients from balance billing from an out-of-network physician at an in-network facility. So we see this all the time in the example of a hospital setting or a surgical center setting, where the doctor who's treating you might be in network, but the facility is out of network, or vice versa. The facility is out of network, but the physician is in network. And then people are stuck in the middle. The important point or takeaway here from this scenario is if a patient has not signed a financial responsibility agreement, then an in-network provider may not be entitled to charge the patient for denied dates of service. So for any treatment that's denied, this will also depend on the contract between the provider and the insurer. But I just want to go over that one more time because it's a really important point. A patient who has not signed a financial responsibility agreement, who receives treatment from an in-network provider, may not be balance billed for those services. Lastly, HMOs. HMOs are health maintenance organizations, and there are very specific considerations that individuals need to examine if they have an HMO. And I'll give you one example of one that comes up almost every day in our practice, and that is Kaiser. Kaiser is unique in that they are the medical provider and the insurer, and they provide services within their health maintenance organization, and that is how they are able to keep their costs low for the members. But if you have an HMO, such as Kaiser, and you want to receive a second opinion or perhaps even receive treatment from another provider that is not within the Kaiser network, then you need to review the terms of your plan or policy to make sure that you are following all of the steps that are outlined for receiving a referral to go out of your HMO. Submitting timely claims. I think that, again, can't underscore enough the importance of reviewing the plan or policy for the requirements and timeframes for submitting claims. Check if the insurer has a claim form, and if they do, you should always use it. If they don't, then you should be able to put together information such as billing records and invoices, but it's always the first step to look at the insurer and see what claim forms they have or what documentation they specifically require. When you're submitting claims, you want to send them by certified mail or another method for delivery confirmation. Keep copies of everything you send to the insurance company. So this is an example of a member reimbursement claim form that is on the Kaiser website, and it very specifically lays out the instructions for reimbursements that members have paid for out-of-pocket services. And it tells the individual to complete the form and sign it. It tells them to include an itemized bill detailing the charges, get a payment receipt, send the form, the bill, and the receipt to the address that's provided at a later section on the form. And Kaiser even tells you to keep a copy of all documentation for your own records. So this is the second page of the form. And again, it provides mailing addresses for different member services depending on the region in which the individual or the patient resides. And it's important to get the address right, because from experience, I can tell you if you send something to Kaiser or any other insurance company and you send it to the wrong address, they are not going to do you any favors and forward it to the right address. you are responsible for getting it to them at the right address. So another practical tip that we often share with people is call in advance and confirm that you have the right address to direct and send in your claims, because sometimes forms or information on the website or on pre-printed forms is outdated and offices have changed locations. So it's never a bad idea to call in advance. So the EOB, an explanation of benefits. As I said, a denial is generally required to be provided, and it usually must be provided within 30 days of submission of a claim. A denial can be in the form of a letter or an EOB. Sometimes people question whether an underpayment of benefits is a type of denial, and the answer is yes. If you believe that you are owed $100 for a medication that you paid for, or a service that you received from a provider, and the plan only pays $10, then you have to appeal that. Because if you don't appeal that, then there is no indication that you disagree with the decision that was made. Sometimes the insurance company will ask for additional information, and that might be authorization forms. It might be medical records. It might be claim numbers. It is important that if the insurance company asks for information, that you respond with the information and that you do it in a timely manner. Otherwise, this could result in a denial of the entire claim. And just to give you a real life example, we had someone who contacted us. The husband, her husband was receiving medical care at a facility in San Diego, and he required chemotherapy at another facility and had to be transported every day from the hospital to the other facility. And the ambulance charges for that 30-day period of time in which he was in treatment exceeded $1 million. And the EOB that denied the claims asked for an itemized bill and record from the ambulance company. So all we did was put together all of the 50 pages of itemized bills from the ambulance company and submitted that in writing via certified mail to the insurance company. And now we're waiting for them to issue a response. This is an example of what an EOB may or may not look like. They do come in different forms, but the one thing in common is that it will say explanation of benefits, and it will say this is not a bill. Sometimes people mistake EOBs for bills. It is simply an explanation of how the claim was processed, what was paid, what was not paid, what the patient responsibility is. I apologize, the quality isn't great, and I didn't really provide it so much for the level of detail of what's printed on here, but the reason I provided it was so that everyone could have a reference point. My main point with an EOB or any bill that you receive, and I recognize an EOB is not a bill, but an EOB, a denial letter, a bill, anything that you receive from an insurance company, from your doctor's office, my main tip is that people need to review it. In this particular case, I reviewed this EOB while that was provided in discovery while the case was in litigation, and I quickly realized that the EOB reflected a certain level of care that was not being provided to the patient. And this was a really critical point and a distinction that we relied on in litigating the case to show the insurance company not only did they get it wrong in denying the claim, but they got it wrong in that they weren't even considering the correct level of care for this individual. So don't assume insurance companies or doctors' offices always get it right. Submitting quality appeals. So if a claim is denied, then you want to figure out what is my best mechanism for getting the insurance company to change their mind. Providers or patients can submit appeals, and plans and policies provide different provisions for what that looks like. But in any event, in all appeals, there are 3 different ways that you can communicate your appeal to the insurance company. You might have an expedited appeal, and I mentioned this earlier, and this is a case in which you show there's a medical need for an expedited basis of reviewing the claim. And this generally ends up resulting in a call between the provider and the insurer's doctors. So insurance companies have doctors that work for them, and they get on what's called an expedited call with the provider to discuss the claim that was submitted. If you are the individual doctor who is talking to the insurance company's doctor, then we always say, don't be afraid to ask the insurance company doctors some questions. Ask him or her, who's paying him? Is it the insurance company? Is it a utilization review company? What are the doctor's credentials? What experience does the doctor have? If we're talking about an individual who is undergoing treatment for cancer, does the doctor have any experience in oncology or in radiation? What is the doctor's experience? If it's an individual who is requesting mental health treatment, does the doctor for the insurance company have any background or credentialing in psychology or psychiatry? These are important things that you want to note and take note of in case the claim continues to be denied and you have to later on pursue litigation or an external review or appeal. These are facts and information that you want to have available. So if your case does not qualify for an expedited appeal because there's no urgent medical need, then you send a written appeal letter to the insurance company. Another option is to call the insurance company and say, I appeal your denial, but this might not be noted correctly by the administrator or by the insurance company. So for us, a telephone call is always the last resort, although sometimes it's the only option that people have if they're running up against a deadline. So if it's the only option you have, then yes, do it. But make notes. What day did you call? What time did you call? Who did you speak with? Get their name, get their employee ID number or an extension where they can be reached. Get as much information as you can in case later on there's any discrepancy as to whether your appeal was timely. When we tell people to submit an appeal letter, it's a little bit more complicated than just writing, I appeal the denial that the insurance company made. We always want to have a quality appeal letter. So what does that look like? This is a very simple appeal letter. Might not be the best appeal letter for every case, but at minimum, if someone were to submit this appeal letter to the insurance company, it would be sufficient. We want to put it in writing and we want to state what you're appealing. So I am writing to appeal the denial of benefits for John Doe's proton beam radiation treatment. So we're saying exactly what treatment was denied. On such and such a date, the insurance company denied benefits for John's proton beam radiation treatment by stating that the requested treatment was investigational and not appropriate to prevent, diagnose, or treat John's medical condition. So we're restating what the insurance company said. Now we want to tell them why they're wrong. So the denial was wrong because, whatever the reasons are, and the risk is, whatever the risk is for John Doe, if he does not receive this treatment now. So this is important. John's symptoms and clinical diagnosis meets XYZ's guidelines. So you have to have a copy of the insurance company's guidelines so that you can tell them why John's symptoms meet their guidelines. Then You're going to enclose treatment records supporting his need for proton beam radiation treatment. You're also going to enclose letters of support from any providers who were involved in John's care and support his need for proton beam radiation treatment. And if you have any scientific and authoritative literature evidencing the effectiveness of the prescribed treatment, then we also encourage people to say that and include that in the appeal, so that the insurance company now can reference everything that you are laying out for them that supports the appeal. You want to sign your appeal letter, you want to date your appeal letter, and again, send it via certified mail so that you have tracking evidence of when it was sent and received. And last but not least, keep a copy of everything that you submit to the insurance company. So again, communicating with the insurance company means that we want to do it in writing whenever possible. We want to take notes of telephone calls with dates, times, representatives' names, and position. Insurance companies will not be held liable for giving incorrect policy information over the phone. Just be forewarned. The written policy always controls. Send medical records via delivery confirmation. If the insurance company asks for additional medical records, if they ask for billing records, whatever information they ask for, send it via delivery confirmation. If you call the insurance company and you don't get the right answer, I tell people all the time, don't be afraid to call again. And don't be afraid to call again after that. Chances are you will continue to get different information, but call until you get the right answer from the right person. And anytime you call or write to an insurance company, be prepared with an authorization to speak on behalf of the patient or family member, because it might be requested. And insurance companies usually have copies of those forms on their websites. There's a new layer or level of communicating with some insurance companies, and this is a very new phenomenon that we're just starting to learn about. So I thought I would just introduce it. Some insurance companies are asking patients to communicate with individuals who are called care managers. And care managers are individuals who have been delegated by the insurance company to coordinate healthcare for plan members who are at risk or have suffered a catastrophic health episode, or who have a condition that could lead to an increased use of services. So we're seeing this start to emerge in cases where people have chronic health conditions and they are using insurance benefits very frequently, and insurance companies are matching them with care managers who can help them navigate their health plan, who can make sure that they are seeing the appropriate specialist, and to help them work in partnership with the doctors and the team of healthcare providers to achieve better outcomes. And that might mean achieving better outcomes where the person is able to access the treatment and get the treatment without denials. It might mean making sure that claims are being paid appropriately. So this is, again, a way in which insurance companies are starting to provide direct access to patients to someone who works at the insurance company and someone who also has a fundamental understanding of their case, so that every time they call in, they don't have to start with a new person at the other end of the phone. We have a couple more things to get through, so I'm going to try my best. Medical necessity guidelines. A plan will have language that says benefits are provided only for services that are medically necessary. Services that are medically necessary include only those which have been established as safe and effective, are furnished under generally accepted professional standards to treat illness, injury, or medical condition, and which, as determined by, in this particular instance, Blue Shield, are consistent with Blue Shield medical policy, consistent with the symptoms or diagnosis, not furnished primarily for the convenience of the patient, the attending physician, or other provider, and is very important here, furnished at the most appropriate level which can be provided safely and effectively to the patient. So again, you have to have a copy of your plan to see how they define medical necessity or medically necessary services, because every plan states they will only provide for covered services that are deemed medically necessary. The bottom line, or the takeaway here, is that it's not enough for a doctor to prescribe treatment. It has to meet the plan's definition of medically necessary. So obtain and understand the insurance company guidelines. Insurance companies have developed their own medical policies that serve as one of the sets of guidelines for the decisions they make regarding medical coverage. The guidelines are likely not referenced in the policy because there's too many of them. So you will need to ask for them. You need to write the insurance company and ask for them, or you need to call and ask for them. Sometimes you might be able to find these guidelines on an insurance company's website. As I said, there might be too many of them to be listed on in an insurance company plan or even on a website, but I wanted to show some examples of some of the guidelines that have been developed because they are very specific and very targeted. So for example, Blue Cross Blue Shield has a policy that was developed addressing charged particle radiotherapy for neoplastic conditions. Blue Shield of California has a medical policy that addresses breast implant management. United Healthcare has a coverage determination guideline that addresses breast reconstruction post mastectomy. So this just gives you a very, very, very small sampling of how specific and how targeted some of these medical policies can be, and why it's important to make sure that you have a copy of these so you know what rules the insurance company is playing by when they're making a decision about the claim that you've submitted to them. So when do you ask for help? When do you or a family member or a client decide that it's time to seek extra help? Well, it depends on the type of insurance. Sometimes a person might exhaust their appeals and their plan might allow them to file a complaint with the California Department of Managed Healthcare or the California Department of Insurance. These are sometimes referred to as external appeals or independent medical reviews. Again, as with everything else we've discussed today, you have to pay attention to timelines and deadlines. Usually these types of appeals or requests for review have an 180-day deadline or statute to be filed. If a person is not satisfied with the external review decision, then it might be time to consider litigation. It might be time to contact someone who has experience. It might be an attorney. It might be someone else that you know who's gone through this process. But if you feel like you're at the end of the road, it's always a good idea to reach out to someone else for a consultation. I'm not going to go read through the next couple slides because we're running short on time, but I do just want to make sure to point out that there are certain laws that are designed to help people with cancer and other individuals who are seeking medical care. One of the laws that I have been citing to often in some of the cases I've been working on is the Women's Health and Cancer Rights Act, which has been around since October of 1998. This has come up a lot recently over the last couple of years as women are seeking breast explant removal surgeries. Some of these related to treatment for mastectomies, some that are not. But this is a really important law for people who are undergoing any type of breast reconstruction to look at to make sure that their plan is in compliance. And the No Surprises Act. This law took effect in January of 2022. And we are seeing it is not being followed or adhered to quite yet. But hopefully, as the year goes on, more insurance companies will start enacting and adhering to this law, because it's a really powerful, powerful tool for people who are receiving what we call these surprise medical bills. And unfortunately, in too many circumstances, these surprise medical bills are often so overwhelming for individuals and families that it ends up putting them in financial ruin. And we don't want to see that happen to anyone who's seeking out medical care or treatment for a health condition. So I apologize that I didn't have a chance to go through the last couple slides in more detail, but there is a lot of information on the slides. And as I said, the slides will be available to everyone who attended today, so that you can refer back to them, so that you can look through them again. And please, please reach out to me with any specific questions, concerns, or issues that you'd like to address, and I'd be more than happy to give you my time to talk to you.
Thank you so much, Carrie, for a really informative presentation and a really engaging one. I feel that this hour was action-packed with a lot of information, so it's fantastic. Thank you, everyone, for joining. We really appreciate your time. And this will conclude the webinar. So we will follow up with follow-up information about how to get your certificate and any supplementary materials, as well as Carrie's great slides. So thank you so much again, Carrie. Thank you again for joining, everyone. And I will now conclude the Zoom.